Okay, you are live.
Okay, good morning, everyone. Chairperson of the Jefferson County Health Department Board of Trustees. I want to call this special meeting to order. 9/12 on March the 3rd. It's a virtual meeting, and I apologize. I've had some computer problems. That's why we're starting late, and my picture's not on the screen, which may or may not be a problem for anyone. So I want to call the meeting to order. Can I have the roll call, please?
Mr. Deal,
Here.
Dr. Henry, Mr. Prater,
Here.
Mr. Pig,
Here.
Ms. Davis.
Here.
Okay, so we do have a quorum and normally read the mission and vision of the health department. James, would you mind doing that today?
Sure. Mission: JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. Vision: advancing the health and safety of Jefferson County.
Okay, thank you. And I should mention too that this meeting is being broadcast live on YouTube. Everyone should have had access to that site. So next item is approval of the agenda. Everybody received a copy of that. Can I have a motion and second to approve that, please?
I make a motion that we approve the agenda item. What's on the agenda?
Okay, a second.
Second.
Okay, so a motion second to approve it. Any discussion on that? Okay, all in favor of approving the agenda as written, please say aye.
Aye.
Aye. Anyone opposed? Okay, so the agenda is approved. We have no old business at this meeting. The new business items are to rescind resolution 2105-2801 regarding the mask policy of the health department. So can I have a motion second to approve that, rescinding that resolution?
Mr. Chairman, I make a motion that we rescind that mask order that we've had at the health department. I don't have the number in front of me, but the number that you just read off, that's it.
Okay. Second.
Second.
Okay, so the motion and a second to rescind the order. Do we need to explain anything about what that order included or what it said?
I think it would be helpful just to touch on it for people that are watching, don't have it in front of them.
Okay. Kelly, would you mind doing that, please?
Sure. Just a quick overview is that the order was a resolution that was passed to install masking for the health department during our COVID response. The board order pertained to all individuals that would come into the facility. And so what we are doing today is terminating that order for all individuals. And then we will have a second motion to implement the CDC guidance for healthcare settings. Basically, Friday, the CDC has changed their focus and their guidelines for what community levels are. And with that, it has transitioned to looking at preventing medically significant illness, minimizing the burden on the healthcare system, and protecting our most vulnerable citizens through vaccines, therapeutics, and COVID prevention. With that, it took our level of our community levels down. And so it has allowed us to open up our areas of our health department and non-clinical areas to have mask optional. We will continue underneath the CDC healthcare settings to do masking in the actual clinic rooms, which is the guidance for source control of communicable disease. But as we stand today, in order to be able to make those adjustments and follow CDC guidelines, we will need to pull back our mask order, which is, I think, a good step in the right direction as far as moving forward.
Okay, thank you. Any questions or comments?
I
on
have
that?
a comment on that. When I went to the doctor last week and I went into my doctor's office, there were no masks in the room when we were consulting with one another. I think that's above and beyond what we should be saying to the people. Once we've rescinded this order, I think that if they want to wear a mask in the health department, that's fine. But if they choose to walk around in there and into the treatment rooms without a mask, there should not be a word said to them.
Ms. Davis, this current resolution that you are voting on is for rescinding the mask order within the health department. So that is the discussion at this point.
And I don't want anybody being told that they should wear a mask just because they've walked into a treatment room.
Ms. Davis, what you're referring to is actually the second item under new business, is discussion about adopting the CDC guidelines, so that we'll have discussion about that at that point. But this particular discussion is only about that rescission of that resolution that requires it in all facilities of the health department.
Okay, I'll bring up that at that time. Thank you.
Any other discussion? Okay, so we have a motion and second to rescind resolution 21-05-28-01. All
You
in
already
favor of rescind? Sorry?
I'm sorry.
That's okay. I'm sorry. I was just asking for a vote on that. So all in favor of rescinding the resolution, you say aye.
Aye.
Aye. Anyone opposed? Okay, so that resolution is rescinded. And then the second item is to adopt the CDC guidelines for healthcare facilities. So can I have a motion and second to adopt those guidelines?
I'll make a motion.
Second.
Okay, so a motion and second. So I think Kelly's already explained those. Is there anything else that you wanted to say about those, Kelly?
Just stating that CDC guidance is basically looking at source control for all communicable diseases. So this is a standard practice in all healthcare settings at this point. As you'll notice, all of the hospital systems and healthcare facilities are still requiring we follow CDC guidance for keeping social distancing and, when feasible, having the source control.
And that includes all hospitals, Mercy, BJC, SSM, correct?
Yes.
Mr.
Okay.
Chairman,
Any other- Yes.
Mr. Chairman, again, I don't think we need any more resolutions or to adopt anything. I think it's quite apparent what people need to do to protect themselves and their own health. There's no laws, no orders. I've been personally seeing my skin doctor over at St. Clair, for example. I walk right in the door with no mask on. I go down the hall, I make a right turn, I go into his office right past the optical center, Dr. Peterson to be exact. I sit in his office without a mask on. When it's time for me to go
Okay, Ms. Davis, could you make your point, please?
Yeah, the point is, there's, if I can do that in St. Clair Hospital, we're the health department, and there's no known diseases right now that's overtaking our county that's contagious that we need to worry about. Everything with COVID is under control. There's treatment for it. Numbers are down, et cetera, et cetera.
Okay.
There should not be any other orders put in place for anything at this time. So
Ms. Davis, all
I would
healthcare
hope
facilities have source
that
control.
we
Ms.
let this
Davis,
die and
all
not-
healthcare facilities have to follow standard practices in order to keep both their clients and their staff safe. There are sources.
true.
Ms. Davis, I would like to be able to finish. Communicable diseases are throughout the community at all points in time. It can be anything from tuberculosis to the influenza and RSV. So
Right, and
these are
Kelly,
standard protocols
prior
to
to
ensure that
COVID,
healthcare facilities are taken care of and the health department is a
right now,
healthcare facility.
COVID is backing off and we're.
Ms. Davis, we're not talking
these
about COVID.
measures.
We're talking about all health.
Right.
All right. All
So
right.
let me just ask-
let's
let
not
me just
debate
make-
this.
let me
Ms.
just make
Davis, you made your point, Ms. Davis. Is there any discussion?
Yeah.
Yeah, I have a
Discussion?
comment.
Go ahead.
Why is the board addressing like department policy like this? This is within the realm of the director to set guidelines for clinical services like that. I don't think this even needs to be a board matter.
I concur.
Yeah, this just needs to go away as far as the board's concerned. If the director wants to do it, she already has the authority to do that within her offices. There you go.
Do you think that it would be helpful though, given the climate, Mr. Prater, that the board have a motion supporting the director?
I don't, no.
So
I, along with
More
several,
resolutions.
the board will support the director and the exercise of her authority to run the day-to-day operations of the clinical.
She does
yeah,
that anyway.
if the board didn't support her, we would have fired her. So,
Right.
I mean, if you want it that clear, it's that clear. This is just, it's unneeded bureaucracy.
Yes.
If
We're
she
done
wants
with
policy,
this. No
she has
more.
the authority to implement them inside the office. I mean, it's as clear as mud to me that way.
It's an operational issue, correct?
Exactly. We need to stop bringing operational issues like this to the board. The board is here, to keep everything running, not to make decisions like this.
I agree.
That's my opinion.
Okay, well, I think we did have to rescind the resolution we
Correct.
made. So that's been done. So if it's a consensus of the board to allow the director to decide on guidelines for the facility, I think that's fine. Do we need a vote on that?
You do because you have a
Christie?
live motion.
Okay. So do we need to amend the motion?
No, you need to vote on the motion that received the second.
Okay. Well, so the motion and second were to adopt CDC guidelines for healthcare facilities. Since we have a motion and second, I guess we have to vote on that. I don't know. I think that's going to be confusing if we vote yes.
So the effect of if the motion does not pass, then that just means the motion died. It doesn't mean that the board takes the affirmative step to not follow CDC guidance. In fact, what Mr. Prater and Mr. Pig have expressed is that the executive director is free to set the parameters for physical entry into the clinical portions of our department without there being board action. So what the public needs to understand is that if the motion fails, that does not mean that we are refusing to follow CDC guidance. It means that the executive director has the authority to conduct the day-to-day business of the clinical portions of the department, including if she believes that CDC guidance should be followed in those areas, that those areas will be masked.
Great. Thank you for that. Okay, so a vote on adopting CDC guidelines. Anyone in favor, please say aye. All opposed, please say no.
No,
No.
No,
All right. So that motion fails. Do we need a vote on the director's authority, or I think that's a standing issue?
No, your bylaws say
not
that
on
she has
the,
the
not
authority.
on the agenda.
Ms. Davis,
Okay.
the bylaws do provide her the authority to run the day-to-day operations of the facility, as Mr. Prater indicated. So she does have the ability to implement masking according to CDC guidance. within the bylaws.
Okay, and one thing I'd like to say is we've been consistent in following CDC guidelines, so I certainly see no problem with that. Any other discussion?
Make a motion. we
Closed
adjourn.
session?
I'd like to, before the motion to close, I'd like to say that I don't want to see anyone turned away from the clinical setting. If Ms.
Excuse me,
decides
it's not
she
on the
wants someone-
agenda. I make a
You know
motion,
what?
we close the agenda.
Second.
Anyway,
Okay,
it's their
so a
constitutional
motion
right to
to
breathe fresh air,
adjourn
so
and a second.
they should not be turned away for any service because.
Ms.
Kelly
Davis,
Vollmer
Ms.
has-
Davis, you're out of order. We have a motion and a
You're
second.
out
to
of
adjourn the
order.
meeting. Do you have any comment on closing the meeting?
Yes, before we close the meeting, my comment is that Kelly Vollmer should not go above and beyond people's
Ms.
constitutional
Davis, that
rights
is
to
not a
breathe fresh
discussion
air.
on the motion to adjourn.
yes.
Do you have any discussion on the motion to adjourn the meeting?
So this all needs to end, just like Mr. Prater said.
Davis, you can
Thank
ignore
you.
me, but that doesn't
Thank
mean
you,
you're
Ms.
less out of
Davis.
order.
Okay, so motion and second to adjourn. All in favor, please say aye.
Aye.
I,
Anyone opposed? Okay, this meeting's adjourned. Thanks, everybody. Remind you that we have a town hall meeting on next Wednesday, the 9th, and masking at that meeting is optional. Hope to